First, we're going to introduce you to the instruments. This is a needle driver and a forceps. I'm going to show you how to hold them. You don't want to put your fingers all the way through the instruments. You want to use the tip of your instruments, and you can often use your index finger to stabilize the instrument. The forceps are held like a pencil. You don't want to hold them this way, which I see people doing on the ward. You want to hold those like a pencil. If you look at a surgical needle, there's a little flat part here where the needle connects, where the suture connects. You don't want to grab there. You want to grab your needle approximately 2/3 of the way from the tip towards the suture. And you want to make sure that your needle is perpendicular to your instrument. Sometimes you'll see us load it a little bit towards the tip. That's fine, but you don't want to load it that way. You won't be able to use it. First, we'll show a basic interrupted suture. You'll use your forceps to grab the skin edge. You want to try to put your needle in as perpendicular as possible. Use your wrist to twist that through the tissue. You can use your forceps to grab the end and rotate through with your needle driver. When you re-grab your needle, you do not want to use your hands. You want to use your needle driver and your forceps if needed. And sometimes I find it helpful to stabilize that on the patient or on the drape to re-grab if you have an issue bumbling in the air. So you can grab the edge of the skin. Once again, you want to try to get your needle in 90 degrees. Use your wrist to twist the needle through. That's why it's a curved needle. You can stabilize with your forceps, re-grab with your needle driver, and complete the motion. In order to instrument tie, you want to lay your needle driver on top of the suture that has the needle. We will start with a surgeon's knot, which is 2 loops around the end of the needle driver. You will grab the end of the suture and you will lay this down. You see how my hands are crossed because that lays a nice square knot. To give you an example of the alternative, if I pulled it this way, you see my knot is not ideal. So you want to make sure you lay that as a square knot, which required me to cross my hands. While your suture is still pulled this direction, you're going to take the tip of your needle driver, lay it on top of the suture with the end with the needle, wrap it around once, grab the tip of the suture, and now I'm going to pull this way, which will allow for a nice square knot. And then you'll do that at least one more time. Your surgeon's knot counts as 2 knots. That was my 3rd knot. This is my 4th knot. So you want to at least do that many, and sometimes we'll do an additional. That's a simple interrupted suture.